welcome to this brand new episode of NEWSMAKERS, the show where we bring to you spectacular personalities and their success stories from various walks of life. Because at NEWSMAKERS, we really aspire to inspire you. My dear lovely audience, I'm your host Simran, and today I'm sitting with the Shah Rukh Khan of the beauty industry. Yes, you can say that because he is donning this industry, doing a lot to make women and men look gorgeous. Yes, we have with us Dr. Gaurang Krishna, who is a very renowned dermatologist, and he's also a hair transplant surgeon. Also that he's the founder of MedLinks. He's been roaming across the globe, doing a lot of things, lots studying in Kitty, and I would like to know a lot about his journey and how is he working. A very warm welcome to you, Dr. Gaurang.
Thank you. Thank you so much, Emran.
Such a glad thing to have you here. You're working in the beauty industry, making a lot of women beautiful, and of course, men. Now I have to start with your journey. You are a doctor,
Yes.
and like I was talking to you behind the camera, and I got to know that you are a family of doctors.
Yes.
But what made you come into this industry of beauty? Why not others?
Okay, see, so yeah, I come from a family of doctors, and these were all hardcore academicians. My father, my grandfather, and pediatrician, medicine specialist. So, as a default, I was supposed to become a pediatrician, but during my MBBS, I realized that. What I saw that life in dermatology, my specialty is much easier because I've seen my father working even when he was 50-year-old, working at night, patients coming at night, and he just can't say no. I didn't want that for myself. I wanted to have some personal life as well, and that's why I chose dermatology. While I was doing my post graduation at AIMS Delhi, I realized that there are more people suffering from hair or skin, of course, but hair problems were getting more and more. So I thought that why not make this as my subspecialty or super specialty, and that's how hair transplant came in. And back in the day, back in 2010, hair transplant as an industry was budding in India and globally. So and I have that surgeon hands, that surgeon wala kida is always there. So which we do not have that much in dermatology. So I wanted to have some kind of surgery also involved in my work, and that's why I became a hair transplant surgeon.
Okay, wow, that's the core area that you're working
Yes,
upon, and
yes.
like you said, ki I have surgeon wale haath.
Yes.
Now, when I talk about hair transplant, it is one of the major things this time.
Yes.
It's just not for men, of course; it's for women also.
Yes.
A lot of women losing hair
Yes.
at a very early age in life.
Yes, yes.
But when it comes to hair transplant, there is a lot of myth also. The procedures are such. Some people have lost life also.
Yeah.
I mean, this myth which is budding around, I would like to know what is the truth behind it.
No, so this is the most, I would say, prevalent myth right now regarding to hair transplant is that it's a very, very risky procedure. In fact, it's the opposite. It's a very, very safe procedure. It's only a skin deep procedure done under local anesthesia. There are no risk of problems with the brain, memory, eyes, migraine, chronic headaches, skin cancers, which people are worried about. There's nothing like that. Unfortunately, of late, bad cases are coming, where in Kanpur recently, it has been talked about a lot in the media also. 2 people lost death within
Correct.
6 months of span. So which was actually unheard of in this industry. Hair transplants are not something new. We have been doing it for 15 years. As a science, it's there since last 30 years. So, but why it's happening now is because unqualified people are there in the industry, unqualified, untrained. There's a lot of quackery going around in hair transplant, and when things are not done in a particular way, it becomes risky. And that is what has been happening of late, that people are getting infected because operations are done in a dirty OT. It's not even an OT, in the basement, in a salon. And if you see the data, all these deaths of hair transplants have happened in clinics where there was no cleanliness, there was no doctor. Couple of surgeries were done in a salon, makeshift OT at night in a salon, and the surgery was done. So, which is very unfortunate. So, hair transplant being a risky procedure where your life is at stake, nothing like that. It is, think of it like what I would say, like a dental procedure, very, very superficial, minor pain, minor swelling, and that's it. But you have to do it from the right place, you have to do it from the right person. The example that I usually give to my patient is that if I ask you, Simran, is driving safe or risky? What would you?
Of course, it's safe.
It's safe. But you see accidents. Why you see accidents? Because somebody driving under the influence of alcohol, drugs, somebody giving the car keys to a child, and then because he does not know how to drive a car. So when you do things wrongly, then it becomes unsafe. But by and large, things if done in the correct way, in the correct protocol, then there's absolutely no problem at all.
You said it very correctly, and here, audience, I would like to specify here. Like Dr. Gaurang just now said, that you have to have a very good place that you're getting
Yeah.
yourself treated. Cleanliness is one of the major thing, the hygiene and everything, and of course you have to be under the right guidance. Like we have here, Dr. Gaurang with us is doing wonderfully well in this industry, and there's more to listen.
Yes.
Now here we know that. Hair transplant is one thing, it's the need of the hour.
Yes.
Comes the skin as well. Now tell me, now here a lot has been happening in this industry of dermat.
Yes.
Women are, let's say about very young women are into it. They just want to start with their skin regime, but it also comes with very early age. It should not happen.
Yes.
Is it right, or they should start their regime like a skin regime or a treatment at an early age?
So I would say that it's good to start early, because if you start taking care of your skin and hair at an early age, or let's say early stage of problem, then you would not land up doing major procedures. I'm not supporting 18 years old, 20 years old getting Botox done or getting a filler done. No, that is wrong. That's completely wrong. But using a sunscreen, using a good face cleanser, using a good night serum, day serum, if you want to take care of your skin, who does not want to look good? So it's a totally okay thing to do. But take it under guidance, because we have seen, and in fact our society, the IADVL, Indian Society Association of Dermatologists, is very active about abuse of steroids that is happening in this country. In India, we use a cream called Betnovate for fairness. Anything pimple ho gaya, apply Betnovate. You want to look fair. Fairness is obsession here. Apply Betnovate, but that's a steroid. And if you abuse the medicines that are used for certain medical indications, then you will end up in problems. Topical steroid damage face is a big issue. We have seen people getting uncontrollable acne, skin getting very thin, even stretch marks on the face because of steroid abuse. So if you want to do a skincare regime, do proper research. There's a lot of information in the internet. If you want expert guidance, we are there. And then you start your skin regime. Not just on Instagram, because now, unfortunately, a lot of unqualified people are there on Instagram giving advice. We have seen some very good influencers giving advice about using Betnovate for acne. So, which is not right. So, use your common sense, use your logic, use your research, and then do a good skin regime, good hair regime. But don't, at an early stage, don't go for invasive procedures. That is for
Okay.
40s, 50s.
Okay. So with this, like for the youngsters, if you're watching, you have to be very, very wise. What is the right age to start? And of course, guidance that has been telling you, like you need your parents' guidance, of course, for the skin, you need the right doctor, right surveillance that you need. Now, moving further, so we know that India is towards, it has now become a hub for people coming from all across the
Yeah,
world.
yes, yes,
And
yes,
it's like become a tourist thing for a
yes,
medical,
yes,
skin
yes,
tourism.
yes.
Lot of people are coming in. How MedLinks is taking care of that? Do you cater to such people differently? You have different centers. How do you cater to them?
So, as you rightly said, yes, India has always been a hub for medical tourism, but now it is becoming a hub for aesthetic or cosmetic medical tourism also. The reason is these treatments in US, UK, Dubai. Dubai is different. US, UK, Australia is not covered under insurance. So
Okay.
people have to pay from their own pockets for these kind of treatments, and it's exorbitant in the Western world. So people come to India, Turkey, sometimes Thailand, South Korea to get equally good quality treatments at a fraction of cost.
Okay.
And India is a popular destination, particularly for Australia and New Zealand, and the Indian diaspora of US, UK, and also native Americans who want to come to India as a holiday destination also, and at the same time doing their treatments as well. The reason is everybody knows that Indian doctors, Indian surgeons have huge experience in treating these conditions, and the hand is very good. Also, the cost factor definitely comes in, because if they do this kind of a surgery back in the US versus coming to India, holidaying in India, getting the treatment done, they still save a lot of money. So they get equally good treatment at a much fraction of a cost. And we are, as MedLinks, we are at the forefront of cosmetic medical tourism in India, because we are popular. By God's grace, we are quite popular across the world, particularly for hair transplants and certain skin treatments. And people come to us. They come to Delhi for a week, get their treatments done, and then go back. We do not do things differently. We do the equally good treatments in our Indian patients also, but we have facilitators for people coming from abroad. So they just have to land on the airport, and from there, their travel, their transport, their lodging, their treatments, if they are willing to do some kind of a sightseeing, everything is taken care of by
Oh,
us, because
wonderful.
many people come to India for the first time. Only for this. Recently, only Mr. Matthew Hayden, the legendary Australian cricketer, and his family, they came to us only for 4 days, got their procedures done, and went back.
Wow.
The son Josh, he came to India for the first time,
Okay.
and then he was so happy seeing the hospitality. He fell in love with Delhi. We took him to certain nightclubs of Delhi, nightlife. We showed him the nightlife. He was super happy, and then he's willing to come to India again, not for the treatments, but just to enjoy the vibe of India. So yes, medical tourism, we are right there as a top-notch medical tourism destination for all kind of hair and skin treatments.
Such a great thing that I got to know you're just not providing them with the beauty thing, you're also making them aware of your culture here
Yeah,
and, of
absolutely.
course, making them around so that
Yes,
they
yes,
come back here.
yes, yes.
Now, we know that there's a lot that you're doing, researching rather. You have a lot of things coming ahead in your MedLinks.
Yes,
And of course, you work with a lot of celebs.
yes.
This is one thing that I would like to know. Celebs always have this beautiful skin.
Yeah,
They look voluptuously good,
yes,
beautiful hair and skin.
yes.
Is it fake?
No,
Is it, or like
huh.
you're really helping them to
Yeah,
have that
yeah,
skin?
yeah. No, so see, it's a professional need for them. All of us, all of us want to look good, but for celebs, additionally, it becomes a professional need. So take double care. So they are very particular about the products that they are doing. They do their treatments very, very regularly. They're very, very particular about their diet, their exercise routine, because these things. So your skin and hair is not just external. It's not just the creams and the serums that you are applying. It's what's going inside your body, how you're taking care of your body, and they do it exceptionally well. I've seen their dedication, their commitment. Even if they are out there working till 2 a.m. in the night, if they have to get up at 5 a.m. for their workout, they will do it. So it's amazing, their dedication and their discipline, and that's why they look the way they look. Of course, they are also now out in open, and we also know that one look is their room look, their bedroom look is different, but when they come in front of the camera, there is touch up, there is makeup, both for skin and hair. Even their body, when they're like, say, when the Shah Rukh Khan is shooting a shirtless song and has all the ribbed muscles, it does not look that way all the time, or Tiger Shroff does not look that way all the time, and they are out there in the open. They tell that this is not the body that you strive for. Those six packs all the time is impossible. They go without sugar, they go without salt, without water for many days to get that lead cut. And many influencers are also telling this, that please, what we are showing in during our exercise regime, don't strive for that, be yourself. So the message here is that they, of course, they look much better than how we look, a normal person looks, but because they take care, they have the discipline, they have the right treatment accessibility, and they are knowledgeable. But when they come in front of the camera, there is those touch up. If you see,
That's needed, yeah.
that is there, that is
Yeah.
part of the work, and we have to know the difference between real and that makeup. We have to know that. So the example here is that MSD, Mahendra Singh Dhoni's one video photo got very viral when he came out of Alim Hakim's salon with
For the hair.
beautiful hair, and the next day, another photo went viral when he was signing a bike, but with hair looking very thin. So even in hair, not just in the skin, even in hair, there is a lot of makeup. So when you see a celebrity coming out of a salon, or for a promotion video, or in an ad, there's a lot of makeup that has gone in the hair. There's a lot of powder, a lot of styling product. Their hair does not look like that every day. So the audience, the patient, they should be aware that there are makeup for hair also.
All right.
Yes.
Okay. So now, audience, of course, coming back to the generation here who's watching. See, if you need to look good, you need to also accept the fact that all days you can't look, beautiful, or maybe you need to take care of your skin. Now, when we talk about taking care of skin, and you said that they are very cautious of their body,
Yes.
how do you see like putting yourself fit? Does this also help in putting your skin fit?
Absolutely. So, your skin, your hair is the mirror of your body. What is going inside is what is visible. So,
Correct.
if I am not healthy inside, I'm stressed out, I'm depressed, I'm not eating well, I'm not hydrating myself well, it will show on my skin. The skin will look dull, skin will look wrinkled, the hair will look lifeless, non-shiny. But then, if I take care of myself, take my protein, take my vitamins, minerals, take my vegetables and fruits, drink a lot of water, sleep properly, exercise properly, it shows on my skin. The skin glows, the hair looks better, the hair fall reduces. So, and that is why the celebs, the people who do take care of their diet, take care of their exercise routine, sleep nicely, take less stress, have healthy habits, it shows on their skin. The skin glows because they are healthy inside.
So that's the fact that we've been learning since childhood, that you have to be very cautious of the way you're sleeping time and
Yes,
everything, and of course
absolutely.
that reflects on your skin.
Absolutely, absolutely.
Now, there's this thing in my mind which is really, hitting me hard. Uh, Losing hair, getting bald, is a very, this when do you happen to lose your
Yeah,
confidence?
yeah.
Do you have any story of somebody whom you given a hair transplant and the person really came back to you saying that you made my life
Yeah,
happy?
yeah, yeah.
I'm sure
So
you would have many.
we have quite a lot, but one that strikes me, of course, we can't take names, but it's a very interesting story. So this was this young boy, as in around 27, 28-year-old, 29-year-old boy, good looking, good, coming from a good, rich family of Delhi, but super depressed. This boy tells me that I don't get pictures clicked. Even if I have to, because of my business commitment, I strike out my face. I have put newspapers on all the mirrors in my room, in my
Oh my
home. I
God.
don't want to see myself. I said, "Oh,
Oh
you
God.
look good." No, I have receding hairline. Believe me, he had hair loss, but not that much. Slight hair loss. We call it grade 2 hair loss. That just the forehead was looking broad and majorly depressed. And now the society has become such that the matrimonial issues were coming. So he was really depressed. I said, "Don't worry, we'll help you out." We did his hair transplant, and 2 years after his hair transplant, he comes with his wife
Oh wow.
and tells me that now things are so good, excelling in business, and just this little thing, just I tell it just hair, but for some people it's becomes such an issue that. And then he said that, see, my life is 360-degree changed. So I am off medication, I'm not depressed, I have a good married life, and the business is growing excellently just because of this. My focus is out of this. I'm in a happy space so far my looks are concerned, and now I'm focusing on my other aspect, the more important aspects of my life. So this is something that was something that struck me very hard, and that's why when I called my father and said that he was always upset that why I took this as my branch, dermatology and hair as my branch, why not surgeon, why not surgery? So I said, yes, I'm. He tells me that doctors are lifesavers. What are you doing? I say, yes, I'm not a lifesaver, but see, I'm a life changer.
Yeah,
I'm changing
wow.
lives. So
Exactly.
that gives the job satisfaction.
You somehow
Yeah,
changed his life and of
yeah,
course saved his life,
yeah,
because
yeah.
somebody getting into this kind of a depressive things, of course your looks matter. The
Yes.
day I've been hearing all like let's say if I talk about Shah Rukh, he keeps telling me the day I people stop seeing me, or maybe if I have a dull day, I think that will be the last day of my life. He's very
See,
perpetual of this,
yes,
that
yes.
I want to remain in the industry, look nice, look better,
Yeah,
look good.
it's there.
So
Yeah,
that's
absolutely.
the important fact. Okay, so we also know that in this era, beauty is just not for women.
No, no.
Men are very
Yeah,
cautious,
absolutely.
and these days, majorly men are coming, and of course, influencers, they're coming and they're vocal about it. That
Yes.
okay, take skincare, do the laser, remove your hair, do facials.
Yes.
Do you see and do we work on this, MedLinks?
Yeah, yeah, absolutely. So, back in the day when we started 15 years back in aesthetics, and hair has always been male dominated industry, but skin was totally not dominated exclusively for women.
Right,
Not the case right now.
right.
Like 30% of our aesthetic patients are men, and they are so concerned about it. I would not say concerned, they're aware about it. They want to look good, they want to feel good about themselves. Um, as you rightly said, looks do matter. They should not, but they do matter. But and thus the men are very, very particular. They want a skincare regime. They want to get their medical facials done. A laser hair removal in men is huge. So yes, men are catching up with women so far. Grooming and looking good is concerned.
Okay,
Yes.
that's wonderful. But there are times I also, this is one of the concerns that young boys, they also have a very hard time growing their beard.
Oh
And
yes.
what's the reason behind it? Why
Yes.
and how do, how can they get their beard? Because that's, they feel very restless, beard
या
kab
या या
aayegi?
या सो इस वही है कि जैसे हर किसी को मुकम्मल जहां नहीं मिलता, किसी को जमीन, किसी को आसमान नहीं मिलता. बिकॉज सम पीपल आर worried about their excessive hair, some people are worried about they have less facial hair, some people want to look clean and smooth, some people, now the fashion is having a rugged thick beard. So yes, that's an interesting question, because there are many young boys who are concerned about not having enough facial hair. So one, it takes time. So, mass beard is a secondary sexual characteristic. The hair, the testosterone hormone works on body hair, and it increases with time. So, if you are 19 or 20-year-old having less facial hair, do not get worried about it. It will come with time. And but if it doesn't come by 25 and you have very less facial hair, then we say, okay, it is abnormal and we can work on it. So we check for their hormonal levels.
Okay.
Mostly hormonal levels are fine. It's just that they are genetically, they have less. Like I do not have a very thick beard. Somebody would have a very thick beard. So I'm genetically made that way. Some people have even less. So that is normal. But people are concerned about it. So we advise them certain serums that are helpful. We're even doing hair transplant on the beard for facial hair. To grow a beard, we are doing a facial transplant. I'm not a big fan of it. Usually I tell my patients, don't do it. It's, you are going to shave it anyways. But we are doing it. Some people are really want to keep a beard. So yes, it amazes me, but it is a concern for many young men that I want to have more facial hair, and they have a certain way that this is how it should look, and yeah, we have ways of doing that.
Wonderful.
Yes.
So you gave some solace to the people who are watching that, of course, in case we are losing or maybe we don't have it, we can have it
How you
through
can
some
have it,
procedure.
and usually with time it does grow. If it does not, then we are there. That.
Wonderful. So, Dr. Kurang, I would like to know here, uh, every time you go for a beauty thing or a hair thing, whatever, comes with a cost.
Yes. Yes.
And of course, the treatments do have a good amount of money to be,
Yes. Yes.
invest.
Yes.
Now here, how do you, because see, we all have a mindset, oh, kitna paisa lagega, right? People come with this. Half of the generation would not think, but there are people who think before they go. They
Absolutely.
want to get it done, but they're
Absolutely.
cautious.
Yes.
Now, please guide us as to how best do you help people in, getting the right treatment with the right cost-effective
Yeah.
price.
So yes, so it's unfortunate, but it's true that most of the aesthetic treatments are costly, because the products that we are using, everything is exorbitantly priced. Most of the things are imported, and thus the cost becomes double by the time it reaches India. So yes, it is expensive. Our job as doctors is to give them the right guidance, as much as to tell them what you need. It's our job to tell them what you don't need and don't do it. So we always strive for making the correct diagnosis, do minimum possible treatment to achieve the desired result, not overdo things, not do multiple things, ye bhi kar lo, wo bhi kar lo, wo bhi kar lo. We try to understand what the patient is concerned about, what he or she is looking for, and how in the minimum approach, minimum intervention, how he or she will get the desired goal. And that's how we guide them. And that's how we try to keep the price under control, or the cost, or let's say their investment under control. Because I'll give an example of something called fillers. Fillers are to volumize your face. So in the Western culture, in Western countries, let's say in the US, the trend is to do 5 ml fillers, 10 ml fillers, do inject, because it's their society is different. Their spending, purchasing power is different. In India, it's different. So we try to do the same thing in 2 ml filler, 3 ml filler. So try to bring down the cost. Also, all the lasers that we use, these are all mostly Israeli or American machines, and which they're 50 lakh, 60 lakh rupees. But then there are Chinese options also, there are Korean options also. So we have those options as well for people who are looking for a cost-effective solution.
Okay.
So people who are looking the best, there are the best lasers, but there are people who are looking for cost-effective solutions. I'll take that 20% compromise in quality, but I want a 50% lesser cost. So cost effectiveness. So
Okay.
we have options for that also. So our job as doctors is to give them the correct guidance, minimum intervention approach, and try to balance the cost by doing, giving them the option of various products. So there are sunscreens which are of 300 rupees also, there are sunscreens which are of 10,000 rupees also.
Correct.
So depending on what the patient is looking for, how much compromise he's willing to make, he or she is willing to make with the quality, we guide them so that in lesser cost also they get a good outcome.
Right. So this is again one of the best thing that we've got to know here, that there are options in case you would wanting to have a lesser expense. We have an option here. Now we've heard of this glutathione. It's
Yes.
it's too much. It's in the
Yes.
rage.
Yes. Yes.
Almost every second Instagram reel is saying
Is
about this.
glutathione.
What is it and how does it help your skin?
So, see, glutathione is a very powerful antioxidant that was traditionally used for, reducing inflammation in the body, protecting your liver. It was also used in people who were on chemotherapy for cancer to reduce the side effects of
Okay.
chemotherapy. Glutathione was advised, but then people realized that it is lightening their skin also. And again, India we are a fairness obsessed country, so it became very popular in India. The trend started from Philippines, and
Okay.
then India caught up, and it's very very popular here. Um, Back in the day, as academicians, we didn't used to believe in this thing because again, our teaching is that skin color does not matter. It's more about skin health. But then we also realize that yes, there are some people who are concerned about it, and if we give them this treatment, their life will get better. And so we started this treatment about, I would say, 8 years back, and now it has become crazy. Now people are getting it left, right, and center, but people are getting it done at home. People are getting it done in salons. But I would still like to tell this message through your platform is that it's still a medical treatment. This is something that you're injecting directly into your blood, so you have to be careful. We have a protocol. We do certain blood tests before we start doing IV drips. There are certain parameters that we check about. We always ask a patient that try to do it in the clinical setup also only, so that if you get any kind of a reaction, any kind of allergy, we are there to take care of that. But yes, glutathione has become very, very popular. People are taking weekly injections or monthly injections depending on their need to lighten their skin color. What we usually see that it more than lightening, it gives a glow to your skin. It makes your hair look a bit fresher. We also add multivitamins there, so you feel a bit more energetic. But it has to be used in a safe way. There is a protocol. You don't have to overdo things. When you do
Right.
overdo things, then any good thing, if done overdone, can become risky.
Obviously.
So you have to be a bit careful and listen to your doctor for that.
Very
Yes.
rightly said that overdoing anything of course can have a repercussions to it. And please, I'm telling everyone here through this podium, you really need to have a guidance of your doctor in case you're injecting anything or taking any kind of a oral medicine or anything that has been suggested on social media. Please go connect with your doctor because they are give you the right guidance. And like I've been saying, Dr. Gaurang is here, and if you wish to connect, you can search him and you can find him that he's there providing all the information. Now towards the end, we've got so much to speak, but then of course we are constrained with time.
Thanks.
No, we also know about the stem cells and regenerative
Yes.
medicines.
Yes.
Can you just tell us what's the future of this?
Regenerative medicines are basically treatments done through stem cells, growth factors, to normalize your tissue, normalize your skin tissues, normalize your hair tissues. And the future lies there. Nobody wants to keep eating medicines, keep applying serums. And again, as I told you, minimum medicine approach, because all said and done, anything that gives you an effect can give you a side effect when it comes to a drug or a medicine. So we want to make our treatments safer. we want to be lesser and lesser dependent on pharmaceutical products, on medicines, and that is where regenerative medicine is coming in. So we are harnessing your own body's power, your own growth factors, stem cells taken from your own body to heal your tissues. And that is, it's not just the future, it's the present also. So we are doing things like PRP, platelet rich plasma, things like exosomes, things like fat derived stem cells. We are also doing stem cell culture, and we are using for n number of things. We are using it for hair, we are using it for skin wrinkles, we are using it for acne, we are using it for pigmentation, and we are seeing very, very good results. Stem cells are also being used to regenerate your spinal issues, nerve tissue. You have got an accident, the backbone is broken, there is loss of sensation. So neurologists are using a lot of stem cells to regenerate the spinal, to regenerate your nerves, to treat n number of musculoskeletal problems. So for your joint problems, PRP is very, very popular. And this is where the future of medicine lies, harnessing your own body's power to treat your illnesses, to treat your diseases, and to increase your longevity. So stem cells IV injections are being used. It makes people feel more energetic. There's something called NAD plus drips are being used. That is to increase your lifespan. We were just discussing that 100-year is going to become normal. Where in a few years, 100 years human life is going to become normal. That is because of the science-backed longevity and regenerative medicine. So as of now, the regenerative medicine that we are using, the clinic-based, not lab-based regenerative medicines, are PRP, exosomes, fat-derived stem cells, and hair tissue-derived stem cells. So these are very, very popular right now.
All right, and towards the end, I would just want you to give one message to the entire audience here who's watching you. How can you take care of skin in case you're not reaching to the skin clinic? What is the right regime to do every day?
So both for your skin and for your hair, uh, your diet, your lifestyle is absolutely, absolutely important. So we'll talk about skin first. So in your diet, add vitamin C that you can do through amla, aloe vera, etc. And then you will see the glow to the skin is of different level. Hydrate yourself very, very popularly. And when I say hydrate, I don't mean just apply moisturizer. I mean drink a lot of water, drink a lot of fluids, keep your electrolytes up, and you'll see a lot of difference both in your skin and your energy levels. Sunscreens are a bit overhyped. Don't overdo sunscreens. Use sunscreens only when you are exposing yourself to sunlight, not for the tube lights and the computer screens. Those are for people who are allergic to UV rays.
All right.
One important thing is that here, that Indians primarily use sunscreens for anti-tanning. We don't want to get tanned. That's why we use sunscreen. And most of the sunscreen that we use are ultraviolet blockers, and that is to prevent skin cancers. We Indians hardly get skin cancers. So for tanning, you have to use infrared blockers. So check your sunscreen whether it has infrared blocking effect or not. Then it will prevent from. Then that sunscreen will prevent from tanning. And for your hair, diet is absolutely important. Protein, biotin, zinc, vitamin A, and iron. These are the things that should be there in your diet. And less use of chemicals, less use of products. Once in a while, no problem. If you're using, wash your hair so that it does not go inside the skin and damage your roots. So these are the simple things that you can do to keep healthy, flowing hair and a glowing skin.
What a wonderful interview that we've had today, and the very special thing that I got to know, rather important, about the sunscreen thing.
Yes.
And truly, that in fact, if I see for myself, I've been hearing it so much that even I apply sunscreen every time. Now we've got to know the truth behind it, that it has to be applied only when you're exposed to sun, not that you're sitting at home.
Yes.
All the information that I got today, I'm telling you, have really elevated me to a level that I have to start taking care of my body in a way, like you said. And it was amazing. Thank you so much, Dr. Gaurang. It
Thank you,
was
Simran.
lovely having you
Thank
here.
you, thank you, thank you,
Thank you.
Simran.
So here, my dear audience, I'm sure this interview will make a difference to your life. There are a lot of things that has been told by Dr. Gaurang that we need to take care about. And if you're still thinking, please go through this entire video, not just once, twice, thrice, because there's a lot of good info. And you're still thinking where to connect, we have Dr. Gaurang with us. Here's Simran signing off, but I promise that I will be back soon with yet another dynamic personality. Like I always say, stay blessed.